We're going to go ahead with Laurel Baeder for the first topic on our agenda. Laurel, it's all you.
Good morning, everyone. Hope you're all having a good Wednesday. So I just have our regular maintenance update. Our maintenance window is coming up next week on Tuesday and Wednesday. That's the 18th and 19th of January. During that window, we do have some scheduled maintenance planned. There will be some up, and those we do not have an exact time on, but if you notice the website is down, it shouldn't be down for more than a few minutes. So I would say go refill your coffee and come back and check again. If you notice any longer downtimes, feel free to send me an email and I can work with you to get you whatever resources you need. We also have a small item of scheduled maintenance for the submissions web service. And that will be Wednesday, January 19th at 11 a.m. Mountain Time. And we expect that to be down for no more than an hour while we just apply some patches. So if during that time you send us a file and you get some sort of strange error code or no response, again, go refill your coffee, drink it all and come back and try it again, and everything should be back up and running. If anyone notices problems that extend more than an hour on Wednesday, feel free to, again, shoot me an email and let me know. While we're on the topic of maintenance, I have updated the maintenance windows on our website. They're always going to be the third Tuesday and Wednesday of the month. But if you head out to NEMSIS.org and you go to technical resources, in the right column, there's a page called NEMSIS Maintenance Schedule that lists out the maintenance window for each month. So if you just want a quick reference for when those maintenance windows are, that's where you can find it. And then we'll always announce on the call before and after what the maintenance is and if there is going to be any at all. So that's my update on maintenance. And since I'm the next topic, I'm just going to roll right into that. So maintenance update, that was for vendors mostly and everyone. But my next topic is a new dashboard that we're working on, which is the EMS Snapshot dashboard. So the intended audience for this dashboard, Claire, Julianne, I might need your help with this. It's a state EMS director. Help me out.
Yes, you're right on. So it's a director level audience.
Okay, it's a director level audience, and it's supposed to be sort of a one-stop shop dashboard to just take a pulse on where EMS is in your state. And I'm going to share my screen and just sort of display what we've worked on so far. Julianne, I need you to stop sharing first. Won't let me take it from you. So this is sort of meant to be sort of our one-stop shop for where EMS is in a given state. We're going to have a year-over-year call volume. Before anyone says, what's up with this data? It's some test data. That's why it looks a little goofy. We've got type of service for that call volume, either 911 calls or transports. We'll have PCRs to date plus a year-over-year change. Again, these are blank because our test data doesn't include this current year. The agencies that submitted in the prior month, as well as some primary symptoms and impressions. And then we have a section on call trends, and this is actually where we're looking for some feedback. So we want to develop this section on call trends out to show different types of calls of interest. And since we sort of have a limited space on this dashboard, we're trying to keep it small. The idea to maybe rotate which call trends we show each month or quarter has come up. We were wondering if there were any other types of calls you would want to see a trend line on, either all the time or maybe once a quarter. Right now, we've identified cardiac arrests, self-harm related, mental health related, assault related, and opioid use related as another one that we're going to add. But if there's any other call types that would be interesting for an EMS director, we're definitely looking to hear that feedback. I'm going to stop talking now.
This is Ann in Arizona. Even though we hope COVID goes away sometime. Flu will probably always be here. So maybe an ILI.
Yeah, I was thinking the same thing.
All right, great thoughts. ILI trend. Okay. And we're also going to provide some links out to some of those dashboards that are popular and could provide more detailed information. So we already had influenza-like illness down there, so it makes sense to add a trend for that. Good thoughts.
Can I ask a follow-up question to Ann and David? So on this snapshot dashboard, Laurel, if you'll go down to the hyperlinks a little bit, we are creating an EMS by the numbers dashboard that will be a state level based on the visualizations that have been created for that weekly report that's been going out for the last, year and a half. Is it valuable to you for the audience that this will go to, a director, an EMS director, just that broad picture of what does EMS look like in my state right now? Would it be helpful to you to have a ILI trend that looks like these trends in this dashboard, in addition to having a full EMS by the numbers dashboard for your state?
I think the trend line is helpful. I'm not actually familiar with the EMS by the numbers dashboard.
It's not live yet, so that's why you're not familiar with it yet, but it will be very closely aligned to the EMS by the numbers weekly report that goes out. We'll throw that in the chat so that you can see what those visualizations look like. But yes, good point. You haven't had access to that dashboard yet, but it's a full other dashboard where this one is meant to give that overall high level picture. So it might be useful to have that trend line there as well in this one.
I think so. So I'm not sure what, if you're trying to see an uptick in those kind of things, you've heard about how New York, fire station New York is short-staffed because of COVID. So you want to see that uptick right away.
Okay, that's helpful, David. Thank you.
I mean, there might be something because I don't know what it looks like either, the other one. For one of the dashboards to have one that either indicates offload times or transports for certain kinds of illnesses. I mean, that would be another one if you felt like the ILA one was duplicated in the other board. I mean, you're thinking about also the severe patients that are going to be transported. It's all we're talking about now. So I think that's why it's on my brain. But, between the stress on the system because offload times to the hospitals are full and the fact that more or less people are being transported because of ILI-like illnesses, it kind of all ties together.
Okay.
But it might not be something for the long term, either. I don't know.
Yeah, that's a good point. So something we've discussed on this dashboard is being able to maybe switch out some of the trends dynamically as interest change. So, right now, maybe everyone wants to know where COVID cases are going, but in 2 months, we're more interested in assault. So that was something we discussed, is having these swap based on trending, but also trying to build a list of what we think might be relevant in the first place. So it's an easy task to change the call trends based on the interest. I also think, from my standpoint, that a little bit of duplication between this report, which is a one-page report, and these other reports, which are just by definition going to be more in-depth, would be okay. It's a lot like that submission email that our state users receive each week, where you get that high-level view in your email, and then you can go into the dashboard and maybe dig into the metrics. So this is the high level view, is what this snapshot is meant to provide. If that sort of clears up the intent here.
Yeah, I think that's actually really nice, because I know in the past, it's always been something that internal reviewers will want to see more of the high level, to just see if it's a relative uptick, as opposed to just because it looks higher today or last week, but what does it look like as the overall trend?
Okay. Well, thank you, Anne and David, for the comments. If anyone else has thoughts or comments on what would be helpful to see in this type of overview, please put them in the chat or send us an email so that we can get those incorporated. We want to make sure that we're building a dashboard that suits your needs and that is relevant and useful to all of you. But I'm going to go ahead and pass it off to the next person now. Thanks, everyone.
Thanks, Laurel. And we'll also talk about, this topic will be on the data managers call next week with the NEMSIS group. So for the state data managers and state people, if you let the idea sit and marinate for a little bit and you have additional feedback, we will bring up the topic next week on that DMC call as well.
So Julianne?
Yes.
This is Judy in Texas. You said this was aimed at the state EMS director audience. Will it also be available to the data managers?
Yes, absolutely. So it will require state level access because it will be specific to your states and to your agencies. But it'll be available to whoever in your state has a NEMSIS account. But the idea behind this one is also a push notification that we will subscribe any state users that would like to have this show up in their email once a month so that they can forward it to the people in their EOC or the people who need to have that level of information, so that it's just at your fingertips more than having to go and find it at the website. So yes, Judy, it will be available to data managers as well.
Okay, great. Thank you so much.
Yes. Any other questions or comments on that EMS snapshot? All right, that sounds good. I have the next topic, and I am super excited to introduce our newest NEMSIS team member. We have added Jennifer Correa to the NEMSIS team. We are thrilled to have her. She will be primarily focused on vendor support, compliance, and as normal for a NEMSIS team member, there will be many other projects that she'll be involved in, but those will be primary focuses for her. Jen, I want you to, if you'll take a minute and introduce yourself. I don't really think you need much of an introduction, but there might be a couple of people on the call who haven't met you yet.
Right. Good morning. For those of you who haven't met me, I'm Jennifer Correa, and I have worked with most of you off and on for a few years, 1 or 2 years, under the AMR, GMR umbrella, and now I have jumped ship over to the NEMSIS TAC folks, and I look forward to working with everybody in my new role. So some of you I'll get to talk to a lot more, and a few of you a little bit less, but I have a feeling I will still get to talk to everybody. So I am super excited and looking forward to it.
Thank you, Jen. We are thrilled to have you on our team. All right, next item on the agenda, I'm going to turn some time over to Josh Legler. He's going to talk a little bit about 3.5 national custom elements and some updates to the 3534 translation.
Great, thanks, Julianne. Let's see. Okay, this is actually two topics. They got onto one line on the agenda, but just in case you're confused, they're two different topics. One is that the NEMSIS TAC has published the NEMSIS 3.5 custom national custom elements. You'll recall there's a state data set file for those national custom elements. And so those are in the repository. There's the release 340 branch, which has been around for a long time. And then a few weeks ago, the release 350 branch was added. And the master branch now tracks 350. The national custom elements for 350 are largely the same as the ones for 340. I'll just show you the commit message here. The difference is the custom values for ePayment.05 are removed because they are standard values in NEMSIS 3.5. And basically everything else just looks the same. So there's the national custom elements for NEMSIS 3.5. So hopefully if you've implemented those custom elements in your 3.4 systems, then you can go ahead and grab these configurations from that state data set file to implement in 3.5. But yeah, really relatively little change other than taking out the ones that are no longer necessary. Any questions on the custom elements? Okay, the other topic I have is changes and updates to the 3.4 and 3.5 translations. Those have also been published. They're in the NEMSIS public repository on the release 350 branch. These are the results of discussions we had a couple months ago on this call about potential changes to the translations. So I've brought up here just a highlighted changes version of the 3.4 to 3.5 translation, and I'll do the same in a moment for the 3.5 to 3.4 translation. I'm not going to take a ton of time on these, but I'll just sort of highlight the areas where the significant changes are. So let me scroll down some and get to the disposition section. For 3.4 to 3.5, we made a little bit of an improvement in translating final patient acuity because 3.5 has a new value, dead with resuscitation efforts, that we can potentially decipher from looking at some other data in 3.4, specifically the incident patient disposition. And then in the disposition areas, you'll notice that the changes are in the assists and the dead at scene dispositions. So you can just kind of see here where some of these changes came up, where we made some small adjustments to how the 3.4 value would translate to the new elements in 3.5 for assists and for dead at scene. And finally, transport disposition there. Okay, and last thing here in this 3.4 to 3.5 translation is for level of care provided per protocol, a little bit of correction there on those mappings. In 3.5 to 3.4, the translation changes are mostly in the same areas. So let me scroll down. First of all, though, we made that change that we discussed about the new values for gender in 3.5 and how those would map to 3.4. So that change has been made. And then we continue on down, we'll get to the disposition stuff. And again, focusing on these areas where the patient was dead at scene or it was an assist. Some improvements to those mappings, trying to just get things refined and a little bit higher quality on those translations. So you'll see again the dead at scene type dispositions here are the ones where the changes are, or the assists. So that was all from the discussion and feedback that we had from vendors who provided suggestions, and also your input and feedback on these V3 calls a couple months ago. And so with these changes, it now means that if we take a 3-4 public assist, it'll map to 3-5. And if you were to then turn around and translate it back the other direction, it would end up being a public assist in 3-4 again. Whereas previously we weren't really supporting any of the assist dispositions in a way that could be translated one way and translated back the other way and get what you ended up with. So just some refinements there, and those again are available in the repository. Any questions or discussion on these translation changes? Okay, great. You know, various areas of tweaking here. These actually affect very few reports. Just a small percentage of patient care reports would be affected by these, but I think this does give us a good improvement overall. Okay, well, thanks.
Thank you, Josh. Appreciate your work on those. And we appreciate all the good feedback that we had on those discussions earlier to make those changes. That's really helpful. Next topic, Lauri Bradt has the next 2 items on the agenda. She's going to visit with us for a little bit about call for 2021 data, and also an upcoming survey that we will be sending out to data managers. Lauri?
Thanks, Julianne. Yes, I wanted to just make 2 quick announcements. The first is that we have set a date of when we intend to close the public release state data set for 2021, and that is February 18th. So if you can keep that in mind and be working towards that, we really hope to have as many state records as possible submitted by that time, so that that data set can be closed and shared with researchers really worldwide. We looked back at last year, and that data set was shared with 386 researchers who used it, and their research and papers that were written sometimes led to changes in policy or improved practice, and ultimately improved patient care is really our goal. So I just wanted to say thank you for the role you play in helping us to collect accurate and also timely data. If you need any help with that, or if you're having trouble, reach out and we'd be happy to help you with that process. And then the second announcement is that we will be sending out in the next week to state data managers an updated survey where we will ask a few different questions, but primarily we want to know if there's any updates or changes to your plan of your timeframe to transition to version 3.5. Software vendors and other people are wanting to know. And so we'd love to hear an update from you if you can be thinking through that, so you're ready for that survey. And then we will update that on your state pages on our website as well. Any questions in either of those 2 areas? February 18th closure or a new survey to look for? All right, that's all. Back to you, Julianne. Thanks.
All right, thank you, Lauri. Next on our agenda, we've invited Adam Mihlfried and Josh Legler to lead a discussion on the use of UUID in dFacilityGroup and in dFacility01. So Adam and Josh, I don't know who's taking lead on that discussion, but I'll turn it over to you 2.
Okay. Well, I guess I'll start off since I had the initial email to TAC, and it's real simple, everyone. For those who have, implemented 3.5, we were looking at the UUID for the dFacility section, and you'll notice that there's 2. Oh, thanks for sharing that. So you'll notice there's 2 places where you could have the UUID, the dFacilityGroup at the top, and then the dFacility group in the middle. And we understood the UUID in the middle one there, the dFacility group, to track, name changes, address changes, anything that changes have to do with that facility. You want to uniquely identify that one over time. But with the UUID at the parent section, and the only other real field in there is the type of facility. And we were trying to figure out what the real world use case was for tracking a type of facility change, I guess is the assumption. And through the email discussion, I think we mostly got ironed out that there might not be a real world usage, but for those, back to my first sentence, for those that have implemented 3.5 or started to, was kind of interested in seeing if you knew of a use case, how you're, how you're going to use it. We were just going to give a UUID to each type of facility potentially, because that's the only other thing that's in there. But so that's where I think we were going, and then I'll turn it over to Josh to add more detail.
Yeah, Adam, that was a great intro. The UUID, the technical design when UUIDs were added was that in the demographic data set, every element that could occur multiple times and had at least one child element was given a UUID attribute. As a counter example, dFacilityGroup, it can occur multiple times, but it has no children, so it has no UUID. But dFacilityGroup does have children, and so it was given a UUID attribute. And at a technical level, this makes sense. It represents a data object, a dFacilityGroup. And then within that data object, there are data objects that represent the individual facilities. However, in the real world, if you took a particular facility and you changed its type, you would probably, in the data structure, that facility would move from one facility group to another facility group that has the right type of facility. And so, yeah, in the real world, it got, as we looked at it, it's kind of funky to track the facility group, but it will need a UUID to be valid in NEMSIS 3.5. My guess is that most of you store your facilities in a more flattened structure than this. And what I mean is that you probably store dFacility.01 just as part of each facility instead of having this hierarchy here that the NEMSIS standard has. So like Adam said, he can assign a UUID to each type of facility value, and he can stick that UUID in when he exports data. But we were also curious what others are doing, if that's at the local agency level products, if that's how the rest of you are planning to do it. And then for state level products, when you receive and process this data, what is it that you're implementing? Are you tracking these facility groups, or are you really kind of overlooking that and tracking just the actual facilities and tying type of facility to each one of those? So I wanted to open that up. I don't know if any of you have anything you could comment on. We just want to make sure that everyone is aware of this and it has a plan in place to fulfill the technical requirement as well as kind of the real world needs.
If you're being lazy, you could just do one dFacilityGroup for each facility group and just do it that way.
True, you could, yeah. Yep, so in other words, you could have a dFacilityGroup where the type of facility is hospital and it has one facility in it. And then you could have your next dFacilityGroup and the type of facility is also hospital and it has one facility within it. That would be technically valid.
Does this affect medications and procedures as well?
Yeah, so procedure group has a UUID associated with it and medication group. And so it's a little more flattened perhaps. But anyway, that's what that looks like. Also throw in, you'll see this in personnel where a person could have multiple immunizations and each of those has a UUID. They can have multiple licenses, so there's a UUID there. I think, Oh, and certification levels within their agency. So there's a UUID there. So let's flip it back to facilities here. Anyone have any comments on what you're doing or any issues that you might run into with this structure? Especially state level products, you're receiving this data and you have to be able to process it successfully.
Oh, no, I know how this feels.
Okay, well, if nothing else, Adam has highlighted it for you. And hopefully it's something you're just dealing with appropriately in your software.
Yeah, we receive DEM files not as a state repository, but like you said, we don't pay attention to the tag at all. We flatten it.
Ah, okay.
It's just not useful for it. That seems like a storage optimization more than a anything meaningful, kind of what you're getting at. So yeah, we've flattened it.
Okay. Yeah, I expect that's probably what most software products have done.
Yeah, and I brought up the medication procedures group also because I guess they're just single codes in NEMSIS, but for us they're more complex. They got names and multiple codes and things like that.
Okay.
So yeah, kind of wonder about that if that's maybe something that should be something for the future, but.
Yeah, so the way this was designed, I think there's at least a real world application here, which is that the agency has a list of procedures that they permit their, each level to do. And so the list that they permit their EMTs to do is going to have a particular UUID connected to it. And the list that they have for their paramedics is going to have a different UUID connected to it as well.
Yeah, that's kind of just inside out from how we usually think about it. So we present a list of procedures and then they can choose who can do each procedure. That just kind of more intuitive to how it was set up for our system.
Got it. So conceptually, it's like you've got the procedure as a one-to-one and the license levels are a one-to-many.
It would be so procedure group, one-to-many, and then they'd be pairs. So each procedure has a set of levels. Yeah, like you said.
Yeah. Okay. Okay. Cool. Adam, any final thoughts on this one?
No, I really didn't. It was just since I didn't hear it before, I just figured I'd throw it out there as we're going through them. The only other thought I could think of is I know in the compliance testing last year is we had to make our own custom dFacilityGroup, and that maybe it was put there for if you had to define your own type of facility, and for correlation purposes, if you decided to rename your custom item, I don't know, but so no worries. It's like I said, it wasn't a difficult thing. I just noticed it and threw it out there.
Great. Yeah, I think it was helpful to highlight. All right. Well, thanks.
Thank you, Josh. Thank you, Adam. And we appreciate the discussion on that as well. Next item on the agenda, let me share my screen and we'll get this up so you can see what I'm looking at. Move stuff around a little bit. I just want to share with you where the current 3.5 data use agreement is located on the website for state data managers to be able to pull down and start that process within their state if they haven't already. I know we've sent this out to a few data managers, but we'll share it with everybody so everyone's got it. Under the main page for NEMSIS, using EMS data, go to the State Data Use Agreement sub-tab. And then if you go midway down the page, here is the 3.5 DUA. This is in PDF form. We have our team working on a PDF fillable form so that it might be easier for data managers to add in the fields that need some customization. And then if you require a Word document or a different type of document that you can edit a little bit more, just let us know and we're happy to send that to you. One of my questions for you is, would it be valuable to use or to set up digital signature for the data use agreements? Do any of the states anticipate being able to use digital signature instead of a wet signature on the DUAs? Is that a valuable addition to this process or not?
Hey, Julianne, this is Karen.
Hi, Karen.
I'm going to share that from the past, my past life at the NEMSIS TAC, there were a lot of digital signatures. So I'm just going to chime in for some of the state data managers that I do think it'd be beneficial.
Okay. Thank you, Karen. All right, we'll go ahead and make that an option on these PDFs for digital signature as you go through that process with your state. I will throw in the chat where this is located so that you can get to it easily. Let's go, everyone, and send it to you. There you go. All right. Next on the agenda is an ET3 update. We've invited John Beckett and Brenda Staff in. If you would like to give an update on the ET3 project, that would be terrific.
All right, thank you, Julianne. I'm going to share my screen. Give me a second. Okay. All right. So yeah, I've got a few updates just to jump into them. We do want to just give you some context on submissions. We've got about 128 active submitters, meaning they're giving us data on a regular basis. We are tracking up until the end of the year of December. And as a lot of you know, the December date is not really due in until January 31st. So we are going to be reporting numbers as of December 2021, and we're about 10.6 million records that we have received that reflect that period. This includes historical data records as well. We also have implementation plans that are due from the participants. I know this isn't a participant group, but just wanted to point that out. And we have a February date that we're looking to have those plans submitted. And then we have a number of participants that have successfully implemented, which means we're seeing claims coming in that they've submitted, and they are correctly using the custom elements in the PCR records. So again, this is very important in terms of staying in compliance with what the program is looking for. The other items that I have, I'm going to go through pretty quickly here. We do have emails that we're sending out to have resubmissions of records. So if you do get an email, if you could help us get those records in, that would be great. Some of those fall into the drop category because of values of the de-agency fields being invalid. Others are being affected by some of the outages that we've had recently. And when you have an outage, a lot of times, if you're not aware of the outage, the software will try to submit those records. And of course, you're going to get those rejected because the server is not acknowledging. So again, we want to make sure those records are in, and this includes planned and unplanned outages. Some of you have software that would just continue until the server's back up. Some of you don't. I just wanted to point that out. In terms of being ready for NEMSIS 3.5, we do have a timeline established, and basically March 15th, we're targeting to be ready for the production environment to receive 3.5 transactions. So we don't have a formal certification process like NEMSIS does, but we certainly want to open up our test environment. We're going to structure it similar to what we did back in 2019, where we have use cases that we're going to provide, and we'll also offer the environment up for a 2-month period for anyone who wants to submit records and then get feedback. We have a team that's also ready to field any questions or issues that may come up. So that test environment is going to be available starting February 7th. So that's, again, something we're going to offer, and we'll run that all the way through to March 31st. In terms of the documentation, it is published. So we successfully completed all of our updates, and it is available out on the NEMSIS site currently. And just as a reminder, we have separated 3.4 documentation and 3.5. So it is new in terms of how you get to the documentation, depending on which version of NEMSIS you're using or looking to get references. In terms of our issues for data submission, there are, again, the ones that I reported last month. So we are at the top of the list fielding the renewal of expiring API security keys. And as some of you know, there is 180 days that you need to factor in for when you are going to renew. So every 180 days, these keys have to be renewed. And so some of you have reached out, and we are going to be, again, accommodating those that have a lot of keys to renew, such that we can set up a separate meeting, and we'll have the right people on the phone that could do those approvals right away. So I encourage you to reach out and let me know if that's something you want to take advantage of. We also have incomplete submissions. So this is where, again, we have data in 2021 where we're looking to have every month of data being submitted, and some of the months are missing. So again, that's going to be something that will be addressed later in the year. And then obviously resolving those submissions where we have those dropped records due to the agency field values. We've come up with a master list that has correct values in them so that our tables are up to date, and hopefully what we're receiving is the correct values from you, and we have those acknowledged in our tables when they are checking them. So again, that's very important that we have an up-to-date list. In terms of missing custom field values, some of the analysis we've uncovered where certain things may have been presented in claims, but when we look at the EPCR records that have been matched, we're not reflecting the same information. So again, this is something that we're going to address later in the year this year. And then the historical data submission, obviously some of you have not been able to submit historical data because it's in a prior format, and we understand those constraints. So again, by letting us know, we can certainly accommodate with everyone's separate situation. I'm just going to cover one more item here. We do have a monthly release schedule. So it is something we have designed to happen on the last Thursday of each month. We're going to set it up so it goes from 5 to 9 p.m. So we're going to try and maintain that schedule as much as possible. Any changes, we're going to make sure that we reach out to you within 2 days prior to the release. So every release that we come up with, we'll reach out to remind you that there will be an outage. And then we'll notify the stakeholders when the maintenance starts in the end. So at the bottom here, I have you can probably barely see it, but I do have some dates in here, and we're going to publish these and send those out to you to make sure that, again, as a reminder, this is the calendar that we're working off of, and you can expect some downtime of our servers between 5 and 9. All right, the last item on the list, and I'm not sure if Brenda is on the line, but just to give you a quick preview, we are coming up with a webinar. That'll be something we're targeting for February, late February. And in the webinar, we're inviting all the vendors and participants. And the agenda here is really to cover just again, some of the important topics around data submission. So the importance of the data, the evaluation monitoring, some of the quality measures, performance-based payments, things like that. We're also going to introduce a dashboard report. And so that is something that will start to go out starting in April. but we'll cover that. And then the topics of PCR data submission, as well as claims data submission. So there will be some folks on the phone, that have some expertise in those areas. We're not meaning to make this a training or get into a lot of detail, but again, to be as a reminder, and we've got a checklist that we want to cover with those topics as well. And then the essential actions to assure we have accurate and timely data submission. So those will be again, and we'll be covered again, and then we'll also field any questions and answers. So I'm going to stop there, and if anyone has any questions or comments. All right, Julianne, thank you guys, and back to you.
All right, thank you, John. Caitlin with Angel Track put a really helpful comment in the chat as well for web services. Thanks for doing that, Caitlin. All right, next on our agenda, items from the Office of EMS. Eric Chaney, this is all you.
Hey, good morning, everyone, or afternoon, morning, everyone. Thanks for your participation today. I have just one item this morning, and that is a request from either data managers or vendors who are working with people to integrate body camera data into their reporting. I don't know that anyone's doing this or has started doing it. If you're in the early stages, that's fine. If you're in at the ending point, that's fine. It's not something we're going to ask you to demonstrate. We have a request from another federal agency who is looking for information on body cam programs. We have some sample programs, or not sample programs. We have some examples of places that have implemented body cams for EMS that we used in the work with Page, Wolfberg, and Worth. But we're just asking for some additional ones, and we're asking for anyone who's looked at integrating this data with their BPCR programs or with their reporting, or has shared it with maybe their local law enforcement agencies. So this is an opportunity to participate in some planning work for some future federal work, and it may be just interesting to see what their take is on some things. So it's not really, I'm not presenting this in a cryptic way. This is basically all the information we have at this point. It's simply a request. And I'm just asking if there's anyone interested or anyone who has been working with the programs. Just send me a name and a contact information, or send it to Clay and Julianne, and they'll get it to me, and we'll be in touch. Otherwise, the only thing I have is, as the new variants are really looking at surges, and please be safe. Please take care of your families, take care of yourselves, and I look forward to continuing to work with you. Thank you.
Any questions or comments for Eric? All right. Before, I should have done this at the very beginning, and I apologize. I have to excuse Clay. He is traveling for a conference presentation, so that's why he's not with us this morning. Next on our agenda, we're just going to go over upcoming events. We have a training offering in February, and this will be a new dashboard for agency locations. This will be a state level dashboard, and Laurel will present this to us on February 1st. Our next V3 implementation meeting is January 26th, same time, same place. And then there are 2 days, 2 federal holidays in January, one in January, one in February, that the TAC will be closed. So just take note of those. Are there any questions, comments, open forum, anything that this audience would like to bring forward at this time? All right. Please feel free to reach out to anyone at the TAC, or Eric is always available. We're happy to take your questions, comments, feedback, suggestions, anything that you are willing and wanting to share with us to improve the EMS data collection process. We appreciate your time and being with us this morning, and with your feedback and comments that are very helpful. Thank you, everyone, and have a great rest of your day. Thanks.